important part is the pranayama, and pranayama is directly related with our air intake or our breathing process. So in relation to that, in the today's session, we'll discuss about what is the correct way of breathing and what is the importance of pure air for our health. So we all know the air quality is becoming worse, especially in the cities like Delhi, because of the unplanned urbanization. The growth of industries, the number of vehicles are increasing day by day. And these all, along with the development, the another side is the air quality is becoming poorer and poorer. And more people are moving towards the big cities, mega cities, and the air quality goes on decreasing. And inhaling this polluted air with harmful toxins can be very detrimental for our health. We know that air, if what the air we are inhaling, if it is not pure air, if it is not fresh air, all the toxins which are there, which are excreted by these all industries, etc., or these vehicles, etc., so that goes to our system and it is extremely detrimental for our health. So ensuring our home and workplace is surrounded by the plenty of trees and far from these industries, factories, etc., which pollutes the air, or at least away from the very busy traffic, busy roads. So that kind of place we have to select for our building home or for our residing. But sometimes it is not possible because we have to select home near to our working place, and it becomes very difficult to have a environment which is very fresh, surrounded by the trees, etc. The another problem is if our workplace, suppose if we are working in some factory or industrial area, so in a day, nearly 8 to 10 hours we are spending in that polluted environment. So it becomes very difficult to have a very or unpolluted air or the good quality air. And because of this, some of the measures like using proper mask, which filters at least the big particles which are there in the atmosphere, and trying to spend less time in the polluted environment, that will help to some extent. And it is also our responsibility to adopt a healthy lifestyle which uses which causes less pollution to the environment. Like instead of going to an individual vehicle, we can select to go for the local transport or the other systems like the train or the metros, etc., instead of going in a single vehicle. So these are the some measures which we have to take individual responsibility, and understand our actions are also important to make the environment safe and healthy. So that kind of things we have to do. And it will also help to make the environment safe and healthy for the future generation. So what is the importance of oxygen for our health? Like the brain. So we say the urdhva mula adha shakha. So like the brain is the mula or the root of our whole body. So like the tree, for a tree, it originates from its root. It sustains because of its root, and it perishes because of its root only. Similarly, the human body, the same importance is given to the brain. So brain controls all the actions of our body. And if our brain is healthy, all the functions in the bodies also goes in a proper manner. For proper functioning of the brain, we require enough amount of oxygen, and what the air which we breathe, so nearly 20% of oxygen of that is consumed by the brain. So when there is a shortage of oxygen, the brain will work slower or it will not function properly. And when the brain is not functioning properly, so whatever the function which is regulated by the brain, and it controls almost all bodily functions, so that all will get affected. The heart, from our intrauterine life, from third week onwards, the heart starts pumping, and it continuously pumping till our death. So this constantly active and this heart beating, it about nearly 1 lakh times in a single day, more than 1 lakh time in a single day. So in a minute, it beats about 72 times. So if you calculate 72 into 60 and into 24 hours in a day, so nearly it comes to the over 1 lakh. 1 lakh times it is pumping continuously without any rest, starting from our intrauterine life till our death. So for the proper functioning of the heart, it requires enough amount of oxygen, because the heart muscles, they utilize oxygen for its proper functioning. And when there is a shortage of oxygen, the heart muscle will not be able to function properly. And when heart muscles are not able to function properly, the blood flow will also be affected, and there will be the chances of developing cyanosis, or the blood may not reach to our periphery, and that may create severe ill health for the person. So proper oxygen is required for the proper functioning of the heart, and proper circulation of blood, oxygenated blood, to all over our body. The muscles, see, when we are working, so because the oxygen demands increasing, the muscles are acting. Suppose we are involving in some physical activities, exercise or running or some athletic activities. The muscles are working. So muscles, when they are working, they require enough amount of oxygen. And because the muscles require enough amount of oxygen, more amount of oxygen, the breath also changes. Our breath rate increases. And this increase is because to fulfill the need of our muscles. And when there is a less oxygen supply to our muscles, the muscles go stiff, becomes tensed, tired. There is excess accumulation of lactic acid. The person will have pain, and that will affect our physical performance. So enough amount of oxygen is required. So only when one is involved in the sportive activities, the coach also teaches how you have to maintain your breathing, or how you have to fulfill the need of oxygen when you are running, or when you are playing, or when you are involved in some heavily physical activities. So how you have to maintain your breathing, and how fast you have to breathe, how you have to take deep breathing, in which manner. So that is also the part of whole training. So enough amount of oxygen is required for the proper functioning of our muscles. And the poor breathing habit can raise a lot of unexpected adverse effect to our body. And some of the most crucial one being like the nervous systems become unbalanced. So when there is no proper amount of oxygen, so the nervous system will not function properly. And this nervous system, which is responsible for carrying out all kinds of functions in the body, that all will get affected. And it will result tense and higher level of stress to our body. The airways get tighter. So what happens when there is a less amount of oxygen? The airways, which contains thin muscles, so that all muscles will get tighter. When they becomes very hard, tight, there will be less flow of oxygen. Again, whatever breathing we are doing, the flow will also get reduced. And when flow will get reduced, there will be less oxygen reaching to the lungs, and from the lungs, less oxygen is going to the blood, and that is how the whole bodily function will be severely affected. So because of this kind of situation, the body tries to manage it, and there will be very fast breathing happens whenever there is such lack of oxygen in our body. Then the blood vessels also get constrict because of the lack of oxygen. So again, the blood vessels, they also have the thin muscles, and for proper elasticity of the muscles of our blood vessels, enough amount of oxygen is required. When there is a less amount of oxygen, then this our blood vessels, they also become harder. The result of this will be excess blood pressure. When the blood vessels become harder, the blood flows with lot of pressure. When the blood flows lot of pressure, there will be increased blood pressure, or what we say as the hypertension, and it will create more stress to our heart also. So that is all the consequences happens when there is a lack of oxygen. And when a person is going to the high altitude, like climbing in a very going to the Himalaya, etc., where in very higher range there is a less amount of oxygen. So these all kinds of consequences will happen. Or even where the person is like going deep in the sea, so they also practice holding the breath for the long time. So that all connected with lot of all physical changes in all bodily function. So these all are the part of, or these all are the consequences one will face when there is a lack of oxygen. And the another problem is the breathing pattern. So the bad breathing pattern, that will decrease the body ability to deliver oxygen to the cell. Like if we are not taking proper breathing, so that the intake of our oxygen, that also get reduced, and because of the reduced oxygen, all the things which we discuss, that all will, the person will suffer with all these kinds of problems. So to ensure perfect health, you need to understand the principles of air intake, or how to breathe properly, that we have to understand. So oxygen is included one of the World Health Organization list of essential medicine. So oxygen is one of the essential medicine for our health, and good indoor and outdoor air quality is fundamental to human well-being. So inside the house also, we should have a proper ventilation, so that we get enough amount of fresh air and proper amount of oxygen for our health. So like nowadays, very closed house or completely centralized AC kind of things. So what happens is there is no proper flow of air. And in long run, when we are there in such kind of environment, it will have very detrimental consequences for our health. On an average, a person inhaled about 14,000 liters of air every day. So in 1 minute, we breathe nearly 12 times, 12 to 16 times. And in one day, we inhale nearly 14,000 liters of air. So you can understand when the air quality is poor, or when there is a lot of pollution outside. So we are inhaling 14,000 liters in a day. So what amount of pollutants we are inhaling, and what kind of damage we are doing to our lungs and other bodily tissues because of this polluted air. So that you can analyze, or that you can infer. And the presence of contaminants in the air can adversely affect the pupil's health. So that is the reason why the people, those who are residing near the industrial area, they have a lot of problems related with the like the asthma, or related with the respiratory system. Several problems they will suffer just because there is no good quality air available to them. World Health Organization data shows that 9 out of 10 people breathe air containing high level of pollutants. and air pollution kills an estimated 7 million people worldwide every year. So you can see, just because we do not have enough amount of air, enough amount of good quality air, so it is leading to the 7 million people worldwide. It is leading to the death of 7 million people worldwide. It is kind of terrorism. When we are polluting the environment, it is a kind of terrorism we are doing to our whole nature. Air pollution is a major concern of new civilized world, which has a serious toxicological impact on human health and the environment. So in the last 50 years, nearly 60% deforestation happened with a human being because of this increasing city area and increasing population, deforestation, cutting the trees. So that has made the air quality very poorer, especially in the city areas. And actually, there is one Matsya Purana. Matsya Purana says this: Dasaputra Samodrumaha. One tree is compared equal to 10 sons. So Dasaputra Samodrumaha. So one tree is equal to 10 sons. So the amount of contribution a tree is doing to this society is equal to the 10 people, 10 sons they are doing. So such kind of importance is given to the trees, and so only we have to protect the tree to the maximum extent, and at any cost we have to try not to cut the trees and protect the environment, because that is the only way we can make our environment healthy, and that is the only way we can make this world safer for the future generation. So breathing is an automatic function of the body that is controlled by the respiratory center of the brain. So we need not have to put some extra effort. Breathing happens very naturally since the time we take birth. Automatically, the newborn will learn how to breathe, and it happens naturally, and it is controlled by the respiratory center which is there in our brain. So an average man who lives to age of 80 may take more than 672 million breaths during his lifetime, and between 17,280 and 20,040 breaths a day. So this is how this our breathing pattern goes on in our life, and how this is important for our health. Though we cannot see the air we breathe, but it is crucial for our life and health. So we cannot directly see the amount of air or the air, whether it is polluted or whether it is safe. We cannot see with our naked eyes, but it is playing a very vital role for our health, and it is very important for our life. That is what we say as the prana vayu. It means the life is because of this breath. The life is directly connected to our breath. So the guidelines for proper breathing. So we have to breathe through our nose. So nose is a kind of factory, or it is kind of filter. So whatever air which are inhaling, when it goes through the nose, it is automatically filtered and it becomes safe, and it becomes little warm, which is suitable for our lungs or to go inside. So we have to always take breathing through our nose only, not through the mouth. So the air, it is automatically refined when we take through the nose, and it becomes suitable for our body system, and it goes to the lung. So the right amount of temperature, moistness, everything is maintained when it is going through our body, and the mucous membrane, the secretion which is there in the nose or nasal mucosa. So what happens is, if there are any harmful bacteria, etc., that all will be filtered there itself, and it will not enter to our respiratory system. or lungs. So we have to take breath with our diaphragm. So diaphragm is a dome-shaped muscle which separates our thoracic cavity and our abdomen. In between that, there is a dome-shaped muscle which we say as the diaphragm. So when we take breath, because of the movement of this diaphragm muscle, what happens? It gives enough space for the expansion of the lungs, and we are able to inhale properly, and enough amount of air is inhaled. So we have to utilize our diaphragm muscle when we are taking breath. So we have to take a very deep breath and we have to inhale enough amount of oxygen. And for this, our diaphragm muscle is helping the movement of the diaphragm muscle. Even other if when there is some kind of obstruction in our respiratory tract, so the person will have the sneeze or the coughing. So that all the coughing and the sneeze, that all is because of the action of this diaphragmatic muscle. So that diaphragm muscle will help for this sneezing or for the coughing, etc. So when we are taking enough amount of air, so it will help our lungs with the gaseous exchanges, which happens to the terminal end of these lungs. And this diaphragm muscle, it also, because it is separating our abdominal cavity and our thoracic cavity. So the organs which are present like the liver and the stomach. So the movement of this diaphragm muscle, it massages the liver and our stomach also, and it also helps for the proper movement of the intestine. So intestine is having this peristaltic movement. The diaphragm muscle is also playing a role to have proper movement of this uh, intestinal muscle or for this peristaltic movement. So we have to breathe in a relaxed manner. So no matter what we want to do, we will do it better if we are relaxed. So we should not be very tensed, or we should not maintain some kind of body posture because of which our breathing process is affected. So we have to be always relaxed and take proper breathing. Since our breathing reflects our thoughts and feelings, so you may just observe whenever you have some kind of disturbing thoughts, what immediately changes is your breath pattern. Suppose some news will come and suddenly you are excited, suddenly you are becoming angry, or suddenly you are becoming anxious. Immediately the change you will feel in your breathing pattern. So you have to always uh, try to be relaxed, and when we are relaxed, we take proper breathing, and that will help to maintain the any kind of situation. So that is the practice of pranayama. When we are practicing pranayama, so we say that if you are practicing pranayama properly, you can maintain your, or you can control your mind, and through the mind you can control your all the thoughts and everything. So that is how it is connected. Because whenever you have some kind of thoughts or some kind of uh, some excitement in your mind, immediately the breath pattern will be changed. So if you are maintaining your breath, you can control your thought pattern also. You can have control on your mind also. So by taking control of our breathing and making it more relaxed, our body tunes and becomes relaxed as well. So which will lead to a better functioning in general. When our body is relaxed, our health is good and our energy is high. It becomes easier to be happy and loving towards ourselves and others. We have to breathe rhythmically. Everything has a natural rhythm. So, like we are waking up early in the morning and the whole day cycle, the this whole day cycle. Similarly, our body will have different kind of secretion in the daytime, like the digestive juice is secreted when the sun is coming up. We feel very hungry. So The whole body is tuned with the natural cycle, which is happen the day and night, the cycle which is happening outside. In the body also, it tunes with this outside changes which are occurring. Similarly, our breathing also has a proper rhythm. So like all our functions are related with this circadian rhythm. Similarly, the breathing pattern is also have a proper rhythm. And that is what when we say that when we are practicing pranayama, so we should learn it properly and we should learn it from a from a well trained person. If we are doing it forcefully, understanding that okay, if I am doing more number of kapalbhati, more number of anulom vilom or nadi shuddhi, this kind of pranayama, what happens is we are changing the natural rhythm of the inhalation and exhalation. So suppose if you are doing in wrong way, or we have not yet understood, and just by seeing some videos, etc., and we are starting practicing, so that may have a very damaging effect to our system also. Like when you are practicing Nadi Shuddhi, in a 1 minute, we generally take 12 to 16 breaths. Suddenly, when we are doing this Nadi Shodhan Pranayama, the breath rate suddenly comes down to the 4 to 6 breathing per minute. So if we are controlling our breathing pattern in such a way, without proper training, it may have adverse effect also. Because I have seen some of the patients coming to our OPDs, they are complaining of so many problems, asthma and other kind of difficulties. And they are very well-known trainer of the yoga and pranayama. So when I inquired, I came to know that they take one session for one batch, and again they take another session for next batch. Like this, they are running 2-3 batches in morning, 2-3 batches in the evening. So what you are doing is you are not doing yoga as it is required. You are making a commercial kind of things for the yoga, and when you are teaching to the, you are yourself doing it. So when you are controlling your body system in such a way, after long run, what will happen? The person will suffer with some kind of respiratory problems. So that is what is seen. So whenever we are practicing, we have to understand the principles of the pranayama. We have to learn it from a proper trainer. Just by seeing some kind of videos or reading some kind of, do not start it uh, and do it more and more thinking that it will give more benefit. Sometimes it may, if you are doing it in a wrong way, it may have some damaging effect to your system also. And breathe silently. So coughing, snoring, sniffing, and so on are suboptimal breaths in disguise. So it's easy to neglect all these sounds we make, and we have to breathe very silently. There is should not create any sound when we are breathing. So that is also important. So the correct breath pattern. So create recurring breath check triggers. So whether we are breathing properly or not, what we have to do is you have to take some time in a day. Like maybe when we are waking up early in the morning before sunrise, we have to wake up and we have to observe our breathing. When we are going for prayer, etc., after the bath, then again we have to check our breathing. When we are sitting in the dining table, again we have to check our breathing. When we are going for the office, sitting in front of our uh, desktop or in front of our files, etc., sitting in our office chair, again we have to check our breathing. Like this, we can define some 5-6 uh, points when we make it a habit that we have to check our breathing, whether I am relaxed, taking proper breath or not, whether there is some kind of fast breathing or some kind of thoughts which are affecting my breathing. So like this, we have to be aware to our breath. We have to see that I'm breathing properly, in the relaxed manner, properly taking deep breath or not. So if you make it a habit, what happens is it becomes a kind of uh, process where we do it for the whole day. That means every activities you will be aware of your breath. And when you are aware of your breath, you will have proper control of your thoughts and action also. So like this, we can plan and we can be aware of our breath pattern. So we can decide some kind of this tricking factors in a day or four, 5 times or 6 times, like this we can decide. And that way we can normalize our breath for the whole day. So analyzing our breathing habits. So to change something, we first need to become aware of what need to be changed. So paying attention on our how we breathe in these different situations. So like when I'm angry, when I am stressed, when I'm going near my boss, when I am driving, when I am watching some movies, or when I am talking to someone I do not have a very cordial relation. In all kind of these several situations are there, different kind of situation in your workplace, in your home, or in your society or surroundings. So in all these situations, we have to continuously see how I am breathing. So this will again help you to be aware of your breath and control your breath in the most healthiest way. So whatever the mistakes are there in our breathing pattern, suppose if we are angry, we are doing some shallow breathing, fast breathing. So if we are aware that no, this is not the right pattern of breathing, so we can be aware. We can again uh, maintain a normal breathing pattern. So adjusting our breathing pattern when we are aware. So we have to again make normal breathing pattern. And as I told that we have to take breathing through our nose. So because nose is a kind of factory which filters all the pollutants, bacteria, virus, etc., which may be there in the breathing air. It moist warms this air, inhaled air, and makes it suitable to enter in our lungs. So these all are important to understand when we are taking breath. So this is in short about the air intake. So if you have any query, you want to share something, some of your experience, you are welcome for that.
Namaste everybody. So you have the mic if anybody have any doubt or question regarding the topic we have discussed today. To please be most welcome. Kindly unmute and have your word with please Bhaiya. We have Rangnath Bhaiya with us. Rangnath Bhaiya, namaste.
Good evening, sir. Good evening. Namaste.
Sir, namaste.
Sir, how are you, sir?
Sir, I am fine, sir.
Good, sir. Nice. I have a small doubt, sir.
Please.
If you permit me, I put forward, sir.
Kindly, sir. Kindly.
Yeah. I'm happy to listen to your talk, sir. Very nice talk because the air is important. Sir, nowadays in summer and winter also we use. Hello. Hello. Is my voice audible, sir?
Ji sir. Please.
Nice, sir. Nowadays in summer and winter also, people used to have the air from the air condition, sir. Is it good, sir?
Yes, sir. Actually, this is being in air condition.
Yes.
Like I have seen in the, like I'm working in a institute where we have the centralized air conditioning system.
Yes.
What happens is in the air, this centralized air conditioning system or the completely air conditioned room.
Yes, sir.
So there will be not proper flow of fresh air,
Yes, sir. Yes, sir.
and the air condition which are available, so
Yes.
they are again they have different capacities, and many times because of this electricity consumption, etc. So
Yes.
we purchase some kind of air condition which uses less electricity, and if the air condition is not very efficient, what happens is the oxygen saturation is slightly decreased in the air conditioned room.
I see. Yes.
So when we are spending long hours in the air conditioned room where the oxygen saturation level is reduced, and we are working for 8 hours, 10 hours, so that may have some adverse effect to our health.
Yes, sir.
Other problem happens in the closed environment when there is like a completely closed, there is no entry of fresh air. Sometimes it will give a chance for growth of these germs, etc.
Like bacteria.
Bacteria, etc. So that
Yes.
also becomes problematic for our health.
Yes, sir.
So we have to be a little bit aware of such kind of things. But actually, this is also true that when the temperature is going to the 43, 44, such level, it becomes
Yes.
very difficult even to maintain with the fan.
Yes,
So
sir.
AC is required, but we have to see that we should also have some provision to frequently go to the fresh air and have proper breathe in the
Yes.
fresh air. So that kind of some provision should be there in the place we are working.
Okay. Sir. That would be alternatives.
Yes, sir. Yes, sir.
Going out. Yes. Sir.
Yes, sir.
Good.
So we can continue our working, but in between some every half an hour, 1 hour, we have to go out, take some fresh air. So like this, some provision should be there.
Okay. Nice.
That
Nice.
will help to have proper fresh air for our system.
Yes, sir. Thank you. Thank you.
So,
Thank you, sir.
welcome, welcome,
Thank
sir.
you.
Welcome.
Bye.
Good evening, sir.
Ji, madam, namaste.
Namaste, sir. Sir, my husband has a vertigo problem, sir. Okay, suddenly if he turns or lifts, his head is getting little bit dizziness. Actually, it was from 1 year. The frequency of dizziness is very less. Once, twice, or thrice in a month. Once in 3 months he is getting, but from last 15 days, that frequency is increased, sir. Okay, he went to doctor. They're suggesting only the Voltine tablet.
Voltine tablet, okay.
Yeah, sir. Is it curable or else is necessary to take the tablet continuously? What it is, sir?
Yeah. Actually, in our ear is having one semicircular canal.
Yes, sir.
So you may have consulted to ENT doctor.
Yeah. Sir.
So our ears,
sir,
it is having semicircular canal.
Yes.
So that helps to maintain a proper balance of the body.
Okay, sir.
When there is some kind of changes in this our semicircular canal, what happens? The person will not be able to have proper balance. So
Okay.
that will create vertigo.
Yes.
So actually, Voltine is one of the common prescription for such kind of problem.
It's
Actually, there is no such. I cannot suggest some medicine which will completely cure this problem.
Okay, sir.
But it will help, as you told that previously the frequency was less, now frequency is increased.
Yes, sir.
So some pranayama, etc. may help, but there is no such. I have not found any such studies where vertigo is completely cured, and when it is having some problem.
Okay, sir.
So There are some surgical procedures also to cure this problem.
Okay, sir.
But I think Voltine is one of the medicine which is helping the patients
Okay,
having
sir.
this kind of problem. So it is better to continue.
Okay, sir. Okay.
But-
Actually, he had some problem in the middle year only. He underwent that stapedectomy surgery for both the years, sir. For the first year, it was 18 years back. And for the second year, it was before 6 years back. Now it makes some problem in his ear, it seems. That's why he's getting that one, sir.
Pranayama may help to reduce the frequency.
Okay, he's doing, sir. He is doing.
So-
And also, I was search for that one in the YouTube. There's just some exercises.
Yeah.
Okay.
It all will help to maintain the situation.
Okay, sir.
जी,
Okay. Okay, sir. Okay. Thank you, sir.
जी. So you may have some question related with the pranayama practices, etc. That also you may share or you may ask.
जी करुणा दीदी नमस्ते।
Hello.
जी दीदी नमस्ते।
Audible, sir.
हाँ जी
Good evening, sir.
जी नमस्ते।
I am suffering with sinus, sir.
Suffering with?
Sinus.
Okay.
Sinusitis. Sir.
हाँ sinusitis. Okay.
In some of the muscles are increasing. The doctor told that like that. Which type of breathing exercise I need to take, sir?
See, sinusitis, whether you have frequently this sinusitis or only in the changing seasons in such situations?
Seasons only, sir. Seasons only.
Okay.
Some of the persons are getting bad smell and some of the persons are getting headache. Those side effects I am not having. Small.
Okay. So actually in such situation, breathing practices will definitely help you for strengthening your respiratory system. And when you are having such kind of issues during the changing season, most of the people, when one season is shifting to the another season, in that transitional period, they have such kind of issues, allergic rhinitis, sinusitis, or repeated sneezing, etc. So when you are practicing pranayama, especially you have to practice this Kapalbhati, Anulom Vilom, these kind of pranayama. So Kapalbhati, we say, like the sinusitis, etc. This is because of the kapha dosha. We say in Ayurveda it is because of the kapha dosha. Kapalbhati, it is mentioned as the kapha dosha vishoshani. So it reduces or it causes shoshana of the kapha dosha. So if you practice this Kapalbhati and again the Anulom Vilom pranayama or the Nadi Shuddhi pranayama, it is the balancing pranayama.
Okay, sir.
So when you are practicing at least these two pranayama, it will help to strengthen your respiratory system, and the kind of trouble which you are getting at present, that may slowly get reduced with the time when you are maintaining the practice properly. So slowly it will get reduced, and the dependency on the medicine, etc., will slowly come down. The only thing is, when we are practicing pranayama, we have to little bit prepare our body to practice it. Like from the day one, do not start just practicing directly the Kapalbhati or Anulom Vilom, etc. There are certain preparatory procedures. So first you have to do some kind of warm-up exercises, etc., to prepare your body. There are some preparatory breathing practices, so that you have to increase your breathing capacity. So with all these practices, then you have to go for the proper pranayama practices. And when you are entering to the pranayama practices, because you are controlling your natural breathing rhythm. So when you are doing it, you have to start with a very minimum minimum level of pranayama, like practicing Kapalbhati 20 rounds, then taking a pause, then again practicing for 20 rounds, taking a pause, then again practicing for 20 rounds. Like this, at least 3 sets you have to do. Slowly, when you are practicing, you will become comfortable to practice it even for the more number of times. Similarly, when we advise for the Anulom, Vilom or Nadi Shuddhi Pranayama, we say that you start with 6 rounds or 9 rounds only. And when you are comfortable with 6 rounds or 9 rounds, then you go for the 11, 13, 15. Like this, you have to gradually increase. Do not sit on the day one and do it for 100 times or like this, thinking that it will help a lot. It will be very good for my system. No, this is wrong way. Very gradually, you have to control your breathing system, and very gradually, if you are practicing properly, then only it will help your breathing or respiratory system. The another thing which will help you is the Neti Kriya. In the yoga, we have the Neti Kriya. So Jal Neti, but that you have to learn only under a proper trainer. Do not try your own just by seeing the videos, because certain guidelines are there. So if there are availability of a good yoga trainer, so you can learn this Neti practices. So that all will help you to reduce these kind of problem in future.
Okay, sir.
But it is very easy to practice pranayama, and it does not require a very long kind of training. If you just
According to the trainer instructions, we need to follow the guidelines.
It is better to initially learn it. Once you will learn it, then there is no need of going to the trainer every time. You can continue. So initially, at least for 15 days, it is good to go to the trainer and learn the proper procedure.
Okay. Thanks a lot.
It will definitely help you for your all these respiratory problems, sinusitis, or all these what you are suffering during the changing season.
Thanks.
जी विनोद भैया नमस्ते।
जी भैया नमस्ते। नमस्ते
नमस्ते
Yeah, namaste.
जी भैया।
या डॉक्टर भैया नमस्ते। नमस्ते। Could you please guide me as to how we can increase the vital capacity of our lungs?
Again, like the pranayama practices, these will help you to increase your vital capacity of the lung. One important thing is use of your diaphragmatic muscles, which I told in the session. The diaphragm muscle is important muscle for our breathing. So one thing is we have to sit straight and take deep breathing, not shallow breathing. So we have to take deep breathing and expand our chest and inhale properly. So if you are doing in this way, in the relaxed manner, not sitting straight doesn't mean that you make your body very stiff. You have to keep your spine straight, but you have to be relaxed.
Relaxed.
So that way, when you are taking breath, what happens is your diaphragmatic muscle, the movement, it helps you expand your lungs, and you take breath properly. So
as for Neti, I am performing it every day.
Neti procedure.
And Jal Neti. And I am putting a little salt there and warming the water. Lukewarm water.
Yes. So this is very good procedure. If you are doing it daily, it's very good.
And around
it is again good that you are putting little salt, because the normal saline water is very suitable for doing
Yes.
this Niti Kriya.
Normal saline water
Ah,
and nearly 200 ml by each one of the nostrils.
It's good procedure. You are doing it in right way. So
And
that will help you. So with you, when you are practicing Niti, I hope you are practicing pranayama also.
yeah. Pranayam also.
Ah.
In your Anulom Vilom, in Anulom Prakriya, while inhaling the air, I do it in 3 phases. 1, 2, 3, 4, 5.
Yeah.
Then stop for a while.
Yeah.
Then take
Kumbhaka you are
1, 2, 3,
maintaining.
4, 5.
Okay.
Stop for a while. Then in 3 stages.
Mhm.
And this is what I have learned from
Yes.
Prakritik Chikitsa Shivir.
Nice. So 2 types of kumbhaka we are maintaining. One thing, when we are breathing out, we maintain kumbhaka, that is pause. And when we are taking breath in, then again we are maintaining pause. So antah kumbhaka and bahir kumbhaka, like these 2 kinds of kumbhaka we are maintaining.
Yeah, antar and bahir kumbhaka.
Yeah.
Recha kumbhak.
Yes.
And ida pingla.
Yeah. So
For
actually,
reduction of blood pressure, left with left Chandra Nadi.
Chandra Anulom Vilom and Surya Anulom Vilom. Yes. So very
Then
nice.
I am performing during summers. I am performing this Shitli Karana.
Shitali, Kari, Sadanta. Yes, correct.
Yeah.
Very nice. Very nice.
Reverse. Reverse.
Yes.
And this is helpful for that thyroid also. I am being told.
Very nice. There is a quote in Hatha Yoga Pradipika, one of the important texts of the yoga.
Kindly repeat it again.
Hatha Yoga Pradipika.
What is that?
There is one text.
Yeah.
So
Hatha Yoga
Pradipika.
Okay.
So,
Hatha Yoga Pradipika.
So this text, it explains that pranayam yuktena sarva roga kshayo bhavet. Ayuktabhyas yogena sarva rogasya sambhava. So if you are doing pranayama properly, following all the rules, regulations, then you can get rid of all kinds of diseases. But if you are ayuktabhyas yogena, if you are not doing it properly, that means if you are
then you are inviting problem.
So that is the importance of pranayama. And so only whenever we are practicing pranayama, we should not forcefully control our breath pattern, because it is directly connected with our life and health. So
but in Bhastrika, we are doing it forcefully.
No. I am saying that forcefully means without proper training.
Yeah.
If you are doing it forcefully, like I have seen some of the people, the day one they will sit and they will do the Kapalbhati for 200 times, 300 times.
But we have to be very regular.
When you are doing regularly,
you have rightly told that we have to increase step by step.
Yes. When you are step by step we are doing, then you will get all the positive effect of the pranayama. So we have to prepare our body and our respiratory system in such a way that we can practice the higher level of pranayama. So without proper preparation, we should not directly go for this forceful controlling of our natural breathing pattern. This is what I wanted to convey.
That's right. Thank you very much. Namaste.
Thank you for sharing.
Nice. If anybody else would like to share their views or ask any question, most welcome. Most of you have the mic and unmute and share. Welcome.
Sir, may I put another one question?
Please, please.
They say that Pranav Dhwani, Omkar, that also increases the vital capacity of the lung.
See the A, U, Ma, these three words are there in this.
A, U, Ma.
So, like A, we say from the Nabhi, from the navel region, you have to pronounce the A. Then from the your chest region, you have to pronounce the U, and from your Kantha, you have to pronounce the Ma. So like this, it is all when we are practicing pranayama, these all comes in the preparatory phase. When we are preparing your system to practice the proper pranayama or the Ashtavidya pranayama, then these all are the preparatory practices when you are chanting A, U, Ma and taking deep breath and doing all this, preparing your system to go for the pranayama. This is all helpful. Definitely it is helpful.
Yeah. Thank you.
మామూలుగా చెత్తలో పడేస్తే అయిపోద్దమ్మా, వాళ్ళు తీసుకెళ్తారు చెత్తలు. हेलो
जी सुबह भैया नमस्ते.
जी नमस्ते.
नमस्ते भैया.
जी I had met with the ligament tear 7 to 8 months back. Can it is 80% it is I have got relief, but can from pranayama I can resolve remaining 20%? जी.
Ligament tear.
हाँ जी.
Ligament tear of your knee joint.
Yes.
Okay. So no, actually, when you have the ligament tear, actually the directly pranayama may not be much helpful. It will just help for the proper oxygenation of your system. But the healing process will happen gradually. And whether you have undergone some surgery or just some kind of medications?
Yes, I used Ayurvedic medication from Patanjali.
Okay. So actually this ligament tear, it will heal very gradually. And at this period of time, the rest is the medicine for you. The rest is the medicine for this healing process. Even do not go for any kind of asana practices at this situation. If you have the ligament tear and still you have problem related to it, do not go even for some kind of asana practice. You be relaxed. Once your normal movement is restored, then only gradually you have to do all these practices. Pranayama will help you for the proper oxygen saturation in your whole body, and this oxygen saturation will help for the healing process, but not like it is not like this particular pranayama will heal your ligament tear. It is not like that, but all over the body it will help in general.
Can I do Surya Namaskar without giving stress on me?
No. Surya Namaskara involves 12 asana. Do not go for Surya Namaskara when you have the ligament tear at present. Or you can consult with someone nearby, a physician, see whether you are ready for it or not. But I will suggest it, unless you have restoration of your normal movement, do not go for any of the practices.
Okay. धन्यवाद. Thank you.
हेलो.
जी.
हेलो.
जी नमस्ते. जी.
नमस्ते भैया. नमस्ते परीक्षित भैया. नमस्ते अखिलेश भैया.
नमस्ते.
I would like to ask one question that now I'm using bamboo brush. So is there any time period that we can use that same bamboo brush? So that I want to ask.
You are using which brush?
That bamboo brush, toothbrush.
Toothbrush.
Yeah, toothbrush.
Oh, so for your mouth cleansing.
Yes, yes, yes.
Okay, okay. So you are asking the time period.
Yes, time period for how many months we can use the same bamboo brush. So that.
Okay.
And it is having the bristles, activated charcoal bristles. That is given on that box that bristles are activated charcoal like that. So how many months I can use the same brush?
Okay. So is still the bristles are straight or they bent and
They are straight.
the condition?
They are straight.
So you can use it, no issue. Actually, when you are using it and the bristles are still straight and doing the work, so you can use it. There is nothing like you have to change it immediately.
Okay.
And normally when we are using the brush, just nearly 3 minutes of brushing is enough for cleansing our mouth. Do not put lot of pressure and do the vigorous movement of using the brush, because it may again injure your gums, etc. And there is a proper movement when we are doing this brushing. We have to do the movement from the down to upward. Like this, we have to do the movement. And first we have to clean the lower denture, and then we have to go for the upper denture. Like this, there is a procedure of cleaning the teeth. So
can we do with the circular movement or not?
yeah, circular we can do, but we have to do this from the downwards to upwards, like this. Like most of the people, what they will do, that they will do the left and right like this. Okay. So not in this way. We have to do from the downward to upward movements gradually. And first we have to clean our lower denture, and then we have to go for the upper denture. Like this, we have to clean, and we have to try to clean the inner aspect of our teeth also gradually without harming our gums. So that way we have to use our brush, and when the bristles are little bit turned or not straight, that time this is the time we have to change your brush.
Thank you, Bhaiya. Thank you.
Bhaiya, for lower denture, it should be, the movement should be from down to upwards.
And down to upward.
And denture, it has to be from up to down.
Up to down. Yeah, like this.
Nice, really nice informative system. So at this time also, let's respect the circadian rhythm, and thank you, Akhilesh Bhaiya, for this enriching informative session, and thank you all the co-explorer family members. We like to have more and more such sessions. So let's meet up again next Friday for more such discussion. Let's call it a day. Namaste, everybody. Namaste.
Namaste, Parikshit Bhaiya. Namaste, Akhilesh Bhaiya.
Namaste to all.
Thank you very much.
Namaste. Namaste, Dr. Parikshit Bhaiya.
Namaste. Namaste.
Namaste, Namaste, Rangnath Bhaiya. Sabhi ko namaste.
Thank you. Thank you.
Namaste.